Midterm votes matter.
Hello, and welcome to the 2022 Good Trouble Voting Rights Podcast, sponsored by Black Women for Positive Change, featuring host Dr. Georgia Dunston and co-host Dr. Stephanie Myers. Ladies, take it away.
Hello, everyone, and welcome to the fifth in our 10-part Black Women for Positive Change Good Trouble Voters' Rights Podcast, where we come together every second and fourth Wednesday of the month to talk about hot topics on why midterm votes matter. In this podcast series, HOT, H-O-T, stands for Healing Our Thinking. Today, we are extremely delighted to welcome to our microphone the dynamic voice of Dr. Valda Crowder to tell us all about why midterm votes matter from the perspective of voting and voting rights on medicine and health. I am Dr. Georgia M. Dunston, chair of the Black Women for Positive Change Science Committee, co-chair of our Voter Rights Subcommittee, and host of this Black Women for Positive Change 2022 Good Trouble Voting and Voters' Rights Podcast. I am joined by our co-host for this podcast, Dr. Stephanie Myers, co-founder and national co-chair of Black Women for Positive Change. With us today is our esteemed guest panelist, Dr. Valda Crowder. Dr. Crowder is a board-certified emergency medicine physician serving on the front line of the gun violence and mental health crises. She's also on the front line of the COVID-19 pandemic, as well as the front line of natural disasters linked to climate change and the fallout of health disparities. Dr. Crowder is national chair of the Health Committee for Black Women for Positive Change. Let me turn the microphone over now to our co-host, Dr. Stephanie Myers, to introduce herself, our guest, and to lead our panel talk today on why midterm votes matter from the perspective of medicine and health care. Dr. Myers.
Thank you, Dr. Dunston, for that very energetic and informative introduction. We are very pleased to have Dr. Crowder with us today. We call her Dr. V for Valda Crowder. And she's very, very popular and has been a real leader in educating our network and hundreds of other people, if not thousands, about the COVID crisis, how to prepare for it, how to protect yourself from it. We're very proud of the regular webcasts that our members have been able to attend. And Dr. Crowder has many, many titles, but one of them is that she's Director of Emergency Medicine at the Community Hospital in Harrisburg, Pennsylvania, which is part of the University of Pittsburgh Medical Center. So that's one of the prominent positions that she holds, in addition to many others. So we're very glad to have you with us today. And I'd like to start off with a question about COVID, because you have been such an early leader in COVID. You were talking about it and concerned about it before most of us had any clue that this was going to go on for years. And I have heard, and we've all heard, that during the COVID pandemic, a disproportionate number of Black and Latino people have died from COVID compared to white people. Is that true? And how did that happen?
Yeah, so that is true. It is an unfortunate aspect of COVID. There have been about 1 million people, a little bit over 1 million people that have died from COVID. Folks are still dying of COVID and still being put on ventilators as we speak. Of those 1 million people that died, about 350,000 of them, or about 35% or so, were Black and brown. And as you all know, we are not 35% of the population. So we absolutely died disproportionately of COVID compared to the majority population. How did that happen? Well, it's a number of things that have all come together. When you look at our healthcare system is not designed to take care of the least of us. When you develop a healthcare system and it is based upon capital principles, it is based upon marketplace principles, there's always going to be somebody who's going to be left out. I always remind people, I said, not everybody gets a 72-inch TV, right? Some people get no TV, right? So if you have a healthcare system that is based upon market principles, you're going to have people that are left out or don't get care that is, or don't get as much care. And that's usually our community. It happens, though, specifically a number of ways. You look at how many hospitals in our neighborhoods have been closing, how much more difficult it is now to get an appointment at a doctor's office. When you get an appointment with the doctor's office, are you able to see a physician? Are they able to actually run all the tests that they actually need to run? Are you in communities that are food deserts? The rate of obesity is directly associated with being in a food desert. Are you employed or not employed? Because that makes a difference as to whether or not you have health insurance. What kind of health insurance do you have? Do you have good health insurance or do you have not so good health insurance? So these are all the things that lead to our communities often being on the short end of the stick when it comes to dying from COVID and really anything else.
Well, Dr. V, when you describe these disparities and hospitals not being available, is this connected to our political system? Does it tie in with who is running our political system and some of the elected officials that have oversight over some of these institutions?
Yeah, so it directly, sometimes people don't realize the importance of who's in charge until something like this hits. So I will give a historic perspective. When HIV was new, it was called immunodeficiency disease of unknown origin. That is what it was. HIV was originally called, and then it was changed immunodeficiency disease of gay men. Some people also called it that. So we had an administration in charge then, which was the Reagan administration, which for a little while ignored it. And it spread significantly amongst our population. And it wasn't until Arthur Ashe became positive with HIV, Magic Johnson became positive with HIV, that people realized that it impacts everybody. So the same thing happened with COVID. Initially, COVID hit in New York. It hit primarily a minority community, and it was sort of minimized. And then it wasn't until people realized that everybody could get COVID that you saw the resources put forth for it. We see the same thing in drug addiction. I tell people all the time, we've had heroin addicts in our communities since the 50s and 60s. Crack was considered criminal. Opioid disorder is considered a medical disease. This is how disparities, which I call medical racism, this is how it impacts us. It's the framing of these diseases, and then how these diseases are framed actually impact how elected politicians respond to them. When they respond to them and they realize that this is something that the community cares about, and this is something that the community wants something done, then we see free COVID tests delivered to our houses, free COVID vaccines, etc. So yeah, it's directly, our healthcare is directly impacted by who's in charge politically.
Well, Dr. V, you talked about health disparities and some of the issues that have been faced during COVID and other medical traumas like HIV, AIDS, and drug addiction. And we are hearing now that there are shortages of the people who can care for people, doctors like yourself, nurses, and that the COVID epidemic has made it even worse. What can be done to address the shortage of doctors and nurses? And can elected officials help with that if people vote for certain people in the elections?
Yeah, so the shortage of the nursing staff is probably what is worse. That's actually probably the most acute problem that we have. And certainly, I know that there have been some Democratic initiatives to improve things like tuition reimbursement. Certainly, the recent $10,000 tuition forgiveness amongst students, those things all make a difference into whether or not someone decides to move forward with graduate training or medical school. So that is really, really important. I do think we need a more coordinated federal multi-state approach look at physician and nursing staffing. We need to be very innovative about how we maybe use foreign workers to actually make the difference where we actually need physicians and nurses.
So when you say we need a more coordinated federal and multi-state network to push for more doctors and especially for more nurses, what can the citizen do to help make that happen? What can people do who are voters and activists in their community help to make that happen?
Yeah, so the main thing that you can do is vote at a local level and vote at also a national or federal level, and vote for the party that you feel actually is taking healthcare seriously. There is a lot of talk that, oh, we have the greatest healthcare system in the world. We do not. We have a healthcare system that's embedded with a lot of medical racism, and our life expectancy has decreased over time now. So if you're dying earlier, that's not the best healthcare system. So I think that we really want to elect politicians that are looking at healthcare, have creative solutions to healthcare, and want to do something about it.
Now, have you observed in your life occasions where a governor or a mayor has clear responsibility on appointing people in key positions of health? Do governors and mayors and county officials appoint people in their jurisdictions who have responsibility for health and medical care?
Yes, absolutely. So every governor actually appoints a head of their Department of Health. And they usually also appoint who's in charge of their Department of Human Services. And those departments actually manage things like COVID tests in this recent situation, COVID vaccinations, the administration of Medicaid, and how people get their insurance through Medicaid. So these are all done through appointments by either mayors or governors.
Okay, and I want Dr. Dunston to step in here if she has a question, but I'll ask another one right now. I see that your background, you worked in the prison system in New Jersey with a healthcare system in Camden, New Jersey. And when you were working with the prison system, did you see places where judges who were elected by people had an impact on the prison system? Does this political arena also affect how the prison systems are run? Have you observed that at all?
So yeah, absolutely. And the work that I did in the prison system was actually in Northern Virginia. But so there's a component of the prison system that is administered by the Federal Bureau of Prisons. Then you have some jails that are run by states and local communities, and those are actually governed by the mayor or the governor of that state, or can also be managed on a county level. So when you look at healthcare that is provided even in a prison setting, that can be dictated on both a local as well as a national level.
So COVID, prisons, all these institutions matter, hospitals, they're all brought under that banner.
I tell people all the time, I say the life of you and your family and your friends is really dictated by who's in charge of key positions that are elected, whether or not it's a mayor, a governor, a president, congressman, etc.
It's a very important message. Dr. Dunston, you want to jump in here?
Yes, first of all, I want to thank you so much, Dr. B, for those responses, and Dr. Myers for those questions, which really get at the relationship between voting, politics, and medicine. I want to look at another aspect for healthcare, Dr. B, and that is the state of what I'll call the quality of healthcare today, in the sense that, as you well know, we are in an era of what's considered precision medicine, based on advances in our understanding of the biology of disease, whatever it is that's rooted in our genetics. And allow me the opportunity as a geneticist to ask you, to what extent are the differences that you mentioned in terms of, you spoke in terms of COVID, but I'm going to say in terms of health disparities, which cover a number of disorders. To what extent does our race-based medicine perspective, shall I say, get exaggerated in situations that we are dealing with today when we look at, quote, one size fits all based on your race? I'm wondering if, to what extent do the disparities that we see in the things you're on the front line with now, to what extent does the fact that precision medicine and the knowledge of the molecular basis of disease impact these differences?
Yeah, so let me just say, I don't use the term health disparities. I use the term medical racism because that's really what it is, right? So when you look at medical racism in our healthcare system, and it's medical racism and sexism, right? Your sex, your race, and your zip code will determine how long you live, whether or not you get an amputation because you have diabetes, whether or not you get pain medications when you're in pain, whether or not you get an appointment with the doctor, whether or not you get a joint replacement, whether or not you have a heart attack and live, whether or not you have a stroke and you get rehab. It impacts everything. And it is so integrally embedded in our healthcare system that we have professionally been working on it for decades and not been able to make much movement in certain quality parameters that you measure. So I remind people all the time that you may think that you actually had an amputation because you had diabetes, but you may have had an amputation because you were Black. And that is the reality of our healthcare system currently.
The question is, to what extent, if any, is the quality of precision medicine based on our knowledge today of genetics a factor in healthcare for minorities, particularly in medical racism?
Yeah, so a couple of things. We have a lot of advances in healthcare, which is what you're talking about, right? So we have, what they call precision healthcare, which is the ability to use genetics and genomics to actually create solutions that are individualized for people, right? Now, you've got to enter into healthcare system in order to get access to that.
Yes.
Right? We do not have everyone in our country insured. Everyone in our country does not have health care, health insurance specifically, right?
Yes.
I want to remind people, there are only 10 other countries in the world that do not provide health insurance for all of their citizens. Those countries are South Africa, Iran, Egypt, Nigeria, Pakistan, Syria, and Afghanistan and Yemen. So this is the company that we're in, right? So so all of these technologies that are great and can do fabulous things and can save lives and improve the health and well-being of people, I can't access it if I'm sitting home and I don't have health insurance. So they're wonderful advances, but they're actually delivered in a way that discriminates against me based upon my ability to have health insurance, or the communities that I live in, or my socioeconomic status, my color, or my sex.
That's wonderful. And I think that clearly brings us back to the direction of responses that you just made to Dr. Myers, trying to tie the politics and why it's so important that we vote, even in getting quality of service that is now available, but not equally accessible.
Correct.
And if I could interject here, I've got a question for you, Dr. V. This is such an important and life changing topic that we're talking about. And we have heard that the young people really don't understand why they should vote. We had a focus group recently where they said that other than the president, they don't see why they should vote for any other group. What would you say to young people who are feeling that they should just stay home and that the vote doesn't matter to them?
Well, I would say to young people, right now we're looking at a situation where state politics are determining whether or not you have the right to women's health. Right? When you talk about, people talk about abortion, but they don't realize that, there are a lot of people that need abortion services that have fetuses that are not growing the way they should be growing. They also don't realize that when you criminalize certain procedures that physicians have been trained to do, are physicians actually going to go and practice in Texas and Oklahoma and some of these areas? You may have a situation where you find it very difficult as a young woman to find even just basic women's healthcare services in 4 or 5 years if these types of politics continue. So I tell young people all the time, I say it's critical. When you talk about climate change, the Inflation Reduction Act is the first time that we have made a significant investment in climate change. We now have people who are dying of heat stroke. We have areas that are experiencing unprecedented heat. A third of Pakistan is underwater. Do we think that's not going to impact us? That is absolutely going to impact us. It's going to impact Miami. It's going to impact Lower Manhattan. It's going to impact a lot of different areas. So I tell the young people all the time, this absolutely impacts you. It has everything to do with you.
That's very important. The Roe v. Wade issue and young women. Do you have a specific message for young Black men? What affects them in particular?
Well, I tell young Black men all the time. I said this is forced fatherhood and paternity payments. Right? This impacts them directly in their pocketbook. Right? And so I tell people all the time, it impacts all of us. We have to wake up and realize that all of this impacts all of us, whether or not you're talking about COVID vaccinations, are we insured or not? Do we get free testing? Do we get free vaccines? Do we get access to transplants? Do we have a hospital in our neighborhood? Do we have doctors in our neighborhoods? All of this impacts all of us.
Mm-hmm.
Do you think that doctors, sure, Dr. Dunston, go ahead.
Just a summary on that. I think that you make the point so clear with all of these things, why, especially for young people, that voting goes beyond just voting for the president. I think
Absolutely.
What you said, you have tied it really into the clarity on all, what do they say? All politics are local.
All politics are local.
And no place shows that more than health and our health things impacting health. So thank you for that. Yes,
You're welcome.
Yes.
Now, one of the things that I've observed about physicians and nurses is that because you're working so hard, many times they're not involved with the political system too much. Now, occasionally, maybe at the Congressional Black Caucus, you'll see Black physicians and nurses there. But on a daily basis, do you find that your colleagues are investing in politics, active in politics, spending money to try to help groups reach out to people with the messages that you've talked about?
Well, we're usually represented by a lot of trade associations like the American Medical Association. The nurses are represented by the various nursing associations. And many of us volunteer within those organizations to testify and provide expertise when legislation is written. So I think there is more involvement with nursing and physicians. We may not necessarily be the ones that catch the camera. we may not necessarily catch the camera light, but I think that there are a lot of physicians. I know myself, I was very involved we had a lot of problems with people denying an emergency department visit, insurance companies, because let's say you had chest pain and then you didn't have a heart attack, you had musculoskeletal pain. They would deny it because you didn't have a heart attack. So we put forth the layman's definition and made it part of the patient's Bill of Rights. So if a lay person determined that it was reasonable that you go to the emergency department, that the health insurance had to actually reimburse that. So that was work I know that myself and another group of physicians did, and we're constantly working behind the scenes and doing things to make sure that patients are protected. Because if the insurance companies deny something, then patients will not go get that care.
Very, very good. And I know we're getting ready to kind of close out here, but just one last question for you. How can we help young people recognize the excitement, the fascination, the economic benefit of the careers in medicine? Because we're desperately in need of more doctors. What can we do to help young people see the benefits of going into medicine?
Well, I think mentorship is important. Mentorship is everything. I know for myself, when I was growing up, I thought my pediatrician was amazing. And so I actually followed her around. I went to the hospital with her. I rounded with her. So I always tell young people, if they think they're interested, grab hold of somebody who's in the profession and see if you can actually follow them for a day. I know we have undergraduate students who come to our hospital and are, kind of sit with us for a day and see what we do and get exposed to it. I think it's really, really important. A lot of people have written off medicine because of the cost. Now, a lot of times, if you get out, we get sign-on bonuses. Nurses are getting sign-on bonuses of $30,000, $40,000, $50,000. Physicians are getting sign-on bonuses of $100,000, $150,000. That goes a long way to wiping out your student loans. So I think that, the marketplace has really made answers for that, but you have to really be committed and know that it's something that you want to do.
Excellent. Okay, Dr. Dunston.
Yes, before we close out, one last area, Dr. V, that we have to get the health perspective on, that's on the top of the list for why midterm votes matter. And it is clearly stated that which way this country will go as a constitutional democracy. And would you, in terms of tying the politics, if you will, to health, can you comment on how politics, if you will, as it impacts the medicine as an industry, if you will?
Yeah.
In terms of even this big issue right now, how the president, for example, even handled COVID, but speak to constitutional democracy as our American form of government opposed to autocracy, if you will.
Well, so here's what I remind everyone. The major insurers in the United States are Medicare and Medicaid. So the healthcare system is driven by government funding at a federal and state level. That is actually what funds almost everything you see in healthcare. Medicare and Medicaid are the majority of our healthcare expenditures. You also have government-owned hospitals. If you are a veteran, you probably have gotten some care from a VA healthcare system that is run by the federal government. So in general, healthcare is significantly impacted through the delivery of care and through the insurance and through the providing of reimbursement through the federal government. And do people want to elect people that want to shrink healthcare, get rid of your insurance, or do you want to actually vote for folks that want to expand healthcare and expand the number of people? We had a significant expansion in the number of people that was insured by the Affordable Care Act. I tell everyone who's voting, you should be demanding that you have the same health insurance as your congressman. The congressmen have fabulous health care, but they've decided that everybody else shouldn't have health care that's quite as good. You should be demanding the same health insurance as the congressmen and women that represent you. And so that's what I actually tell people. That is how it is. It is very much interconnected.
Yes, thank you. Thank you.
Well, Dr. Dunston, I think we're pretty much there. Thank you, Dr. Valda, Dr. V, for being our special guest, and thank you for being chair of the Health Committee for Black Women for Positive Change.
All right.
And I'll hand off to Dr. Dunston. I want to say thank you to Damon Naylor, who is our technical producer. Thank you very much, good brother Damon. And Dr. Dunston, if you'd wrap us up.
In America, we have the power to make a difference in securing an inclusive, accessible, and robust United States of America, multiracial democracy, where all human beings are created equal, that they are endowed by their creator, our creator, with certain unalienable rights. And certainly among these are life, liberty, and the pursuit of happiness. The vote is the most powerful non-violent change agent we have in a democratic society. We must use it because it is not guaranteed. We can lose it. Good Trouble podcast, this Good Trouble Voters' Right podcast is inspired by the immortal words of the late John Lewis in his nonpartisan call to each generation to stand up, and speak out together to redeem the soul of our nation. His word challenged us to heal our thinking, this hot topic today. And we want to thank our guest, Dr. Valda Crowder, for really laying it on the line and speaking to us to why midterm votes matter. I like to say voting is personal. It's personal. Thank you.
Midterm Votes Matter.